So friends, let's talk about surgical site infection classification. So in the surgical site of infection classification, the wound are basically four types, and in this classification, the first type of wound is clean wound. Okay, the first type of wound is clean wound. So what is clean wound? So whenever the wound does not involve any gastrointestinal or genitourinary structures, okay, then such type of wound is known as clean wound. Such type of wound is known as clean wound, and the chance of infection will be, guys, note, the chance of infection will be less than 2%. Okay, and example of such wound are breast surgery. So when you do breast surgery, there will be no communication with the gastrointestinal structures or the genitourinary structures. Similar in case with thyroid surgery also. So when you do any kind of thyroid surgery, there will be no any connection with the gastrointestinal structures or the genitourinary structures. So such wound are taken as a clean wound. Okay, now another type of wound we have is clean contaminated. Clean contaminated. Okay, so basically any wound of elective GI or GU surgery. What it means that whenever any elective surgery we do, so in case of elective surgery, we are already have done all the planning that how we will do surgery, and we will take as much as precaution to not let the wound get infected. That's why in these cases the chances of infection will be around 2 to 10%. Although the wound is somehow clean, though as the structures involves the GI or GU structures, so in these cases there can be chances of contamination, and that is around 2 to 10% chances. Okay, so this is known as clean contaminated wound. The example of surgery are hysterectomy, or the example can be the laryngectomy, or a small intestine resection, Okay, so another type of surgery that we have is third type wound, that is contaminated wound. So as the name suggests, that the wound is highly chance of having contamination, that is the infection is around 10 to 20%, and this is usually seen in any emergency operation. So in any emergency operation that involves GI or GU structure. So any emergency surgery that involves GI or GU structures. Suppose we have to do emergency hysterectomy. Okay, so in these cases there is a very high chance of having infection, and that is about 10 to 20%. Suppose you are doing cholecystectomy and there is spillage of the bile. So in the cholecystectomy there is a biliary spillage. So in this condition also there the wound is usually contaminated. Okay, now the fourth type of wound we have is dirty wound. So as the wound says that I am dirty, so usually the risk of infection is greater than 20%. Even though you take the very good measures, though you have to there is a very high chance of the infection that is greater than 20%. And the very good example is abscess surgery. So whenever there is a surgery abscess, there is a very high chance of having infection. Or you are operating the perforated bowel. So whenever there is a bowel perforation, there is a very high chance of infection. So this concludes our classification. Thank you.